directors, and of course people in the gallery today on this very, very, very warm afternoon. We're currently reading at 30 degrees in the chamber for the Adult Social Care, Public Health and Housing Needs Committee for Thursday, the 25th of June, 2026. General housekeeping then. So there's no planned fire drills this meeting. If you hear the fire alarm sound, please treat it as a real emergency and evacuate the building via the stairs. This meeting is being recorded and streamed live, so welcome to the guys that are watching, and of course the people that have joined us on the net too. Mobile phones should be switched off unless they are being used for the meeting. Please only speak when you're invited to by me, the chair, and speak clearly into your microphone. Onto the agenda. So have we got any apologies and substitutions?
Thank you, Chair. So apologies have been received from Councillor Gordon Adam and Councillor Mark Jeffries. Thank you.
Thank you very much. And onto the minutes. So would you? On this item, we are here to approve the minutes. I'll get on to propose in a second on that one. Can I get a proposer, please?
I propose I'll live there.
And a seconder. Thank you very much, Councillor Welland.
Chair, point of order quickly. Did we vote? We had a proposal and seconded. Did we have?
Yeah, should we have a vote then? Yeah, okay, everyone in favour. Thank you very much. Just apologies. Thank you for that, Councillor Blair. On to the next. So declaration of interest. Do we have anybody, committee members that need to declare their interest in the matters on the agenda? Nope. Thank you very much. Okay, so public question time. We have a question from the gallery. Would you like to stand up and read the question for us, please? Thank you.
Thank you, Mr. Chairman. Adult social care is one of the Council's largest statutory responsibilities and one of its most significant areas of financial risk. What measurable outcomes will this committee use during the lifetime of this administration to demonstrate to island residents that adult social care, public health and housing outcomes are genuinely improving? And how will progress against those measures be reported so that we can continue to hold you to account?
Thank you very much. Now, that is a very big question. And I've had a response with 3 pages long of a response from officers, and of course my own response as well on there. In the interest of moving things on with this, because we've got a lot to cover tonight, we're going to publish it, publicly publish it, and you'll have a copy of it sent to you as well. Thank you very much for your question. It's huge. I've got so much there to go through, but thank you for coming in to present that question.
Thank you, Mr. Chair. Could I have a supplementary?
We don't usually do supplementary, but we can, even if it's not been read out? Yes, of course, have a supplementary, go for it.
My only supplementary on that would be, what is this committee's priorities for the next 12 months? And what are you going to be taking forward to the full council to actually ensure that those priorities are addressed?
Well, we have a work plan coming up at the end of the meeting. If you'd like to sit down and, in this lovely warm weather and listen to that work plan. But we have and also have the corporate management plan, which is coming out hopefully, being discussed between members at the end of this end of July, and that will set our plan as a council over this period of the administration for adult social care and all of the things that we cover in council. Thank you.
Chair, can I ask who's asked the question? It's normal that you tell us who's asked the question. Who's asked the question? It's so that the general public will.
Of course, my apologies. So the question was from Rachel Richards. Thank you very much, Rachel. Members' questions. So we haven't received any questions from the members. that is deemed as urgent. However, I'd like to remind members that you can ask one question if you're not part of the committee with regards to what's being said on the with regards to what's being put out on the agenda, only when it comes up onto the agenda items.
Chair,
Yes.
is that a new addition to the constitution? Or is that not what was previously been observed? I mean, members have been entitled to come to these meetings and maybe not debate, take part fully in the debate, but certainly at the end of the debate, maybe raise a point that they wish to bring up, limiting to one. Are you saying that's per agenda item or one per? Okay, one per agenda. Okay, thank you very much.
Thank you, Councillor Blake. Councillor Lilly.
I just want, as I spoke to you before the meeting, I think it's important as a committee, we always recognise that quite often when you think the ends meet, someone moves the ends in the sense of crisis has come up. We're obviously very hot tonight because of the heat wave, and a lot of the vulnerable residents of the Isle of Wight will be going through a very difficult time. So it'd be useful just to get a very brief update, even if it's coming back to us, not at this meeting, about what is actually happening and how are we as a council responding to people that are going to be seriously affected by heat, right? Or the heat wave.
Thank you, Councillor Lee. Is that something going to answer now, or we could bring that up a bit later on? We'll bring that to you a bit later on with an answer to that. Okay. So before we move on to the next to the main business of today, if we can go around introducing ourselves, especially from our honored guests over here, around this way, so the new members of the committee can work out what it is, who you are, and what it is that you do, and what you're here. Thank you.
Thank you, Chair. I'm Tracy Fisher, Head of Special Educational Needs and Disabilities in Hampshire and Isle of Wight, ICB.
Anthony Harper, I'm the Deputy Director of Children's Care for Hampshire and Isle of Wight ICB, so responsible for commissioning of children's services across Portsmouth, Southampton, the Isle of Wight and Hampshire.
I'm Ashley Whitaker. I'm the Director of Children's Services for the Isle of Wight Council, and I'm here just for the item, the scrutiny item relating to special education needs and disabilities.
Hello, so I'm Sarah Hedges. I'm the Regional Director for Sarah Care.
Good afternoon, Kate Harvey, Director of Public Health.
Good afternoon, Laura Godian, Director of Adult Social Care and Housing.
Good afternoon, I'm Melanie White. I'm the Council Scrutiny Officer.
Simon Wiggins, Corporate Governance, so overseeing the Constitution and the procedure rules and assisting the Chair with any procedural matters.
And I'm Ben Gard. I'm the committee's legal advisor. I'm also here to help the Chairman with any governance matters that might arise. Thank you, Chairman.
Hello, I'm Joanna Smith from Health Watch Isle of Wight.
Thank you and welcome, everybody. So we go on to 6 house scrutiny. Shall I pass that on to the officers now, or have I missed them?
6A.
Okay, thank you very much. So 6A, over to you now. Thank you.
Thank you, Chair. Before you is a reflective scrutiny report looking back at the committee's activity over the last municipal year with learning and areas for development that can be taken forward. Is intended to support members in considering past work to inform future priorities, so starting as you mean to go on, by agreeing to continue with a structured approach to health scrutiny and strengthening ongoing engagement with health partners. This will enable the committee to continue to play a critical role in ensuring accountability, improving outcomes and supporting the health and well-being of island residents. I'm going to take it that the report has been read, and so I'm happy to take any questions that you may have.
Thank you very much. Do we have any questions from the committee?
Thank you, Melanie, and thank you for the work you've done as a scrutiny officer for many years, which has been really good. Is it possible you could, two things, I think one, explain to the committee the link to Parliament and the way that we have powers to report up to the Health Select Committee. I know we've done that in the past. And the other was the fact that a lot of our health now is shared by other authorities. In a sense, the NHS bodies cover other local authority areas, and how on the scrutiny side we can communicate with those other scrutiny committees, particularly and tackling collectively issues that affect us. That in the past, mental health has been a big issue. Dentistry has been an issue where it helps to actually have that link. So that's my questions, right?
In terms of the route to Parliament, that has changed recently. I wouldn't necessarily want to give you the wrong information. So if you're happy for me to take that as an action away, I can communicate out to the committee clearly the route, because it used to be that you would go to the secretary, and I think that has now changed. So if you'll allow me to get the proper answer, I will communicate that to the committee. In terms of communication amongst the other sort of local authorities, I, in my role as scrutiny officer, meet on a quarterly basis with the lead health scrutiny officers from Hampshire, Portsmouth and Southampton. And we take that as an opportunity to be able to talk about any issues that cover the sort of the 4 patches, what's been on their agendas. And I know that in the past, there has been talk about organising a similar thing for the chairs of those committees. And if that is something that you would like me to take forward, I can look to organising a quarterly meeting amongst the chairs of those areas.
Okay, so the recommendations are that the structured approach to statutory health scrutiny within...
Other members have some questions, Chair.
Apologies.
Well, I'll let Councillor Bauer go first and I'll go after if that's fine.
Yeah, I just wanted to know that the Health and Wellbeing, Isle of Wight Health and Wellbeing Board hasn't met since, I believe, October 2025. And I just wondered whether the fact that they hadn't met has impacted in any way on you having risks that you've identified carried forward to appropriate levels, or does it stop the Isle of Wight Health Board putting services in place on the island that we probably need as a result of your risks that you've identified?
The Health and Wellbeing Board is sort of a different entity to the scrutiny side of things. It's its own body. I don't know if Kate might be able to answer that better from my perspective.
Very happy to. The Health and Wellbeing Board, for some context and background, is the kind of pinnacle partnership for us on the Isle of Wight in terms of health and wellbeing and strategic direction to improve health outcomes and reduce health inequalities. So it's a statutory board for the island, has statutory responsibilities in terms of strategy, but also overseeing delivery of the Joint Strategic Needs Assessment and the Pharmaceutical Needs Assessment to help our Integrated Care Board commissioners and NHS England with their commissioning duties as well. The Health and Wellbeing Board met in April but wasn't quorate, so the discussions and the oversight and input to delivery of the strategy continues. The roles are slightly different in terms of strategic leadership for the island's health and wellbeing needs, as opposed to very defined scrutiny functions that sit here. under the NHS Act with regard to NHS services and providers, ICB commissioning duties, and public health elements as well. So I think they are slightly different, but obviously related in that we want good quality health services for our residents as part of what makes a healthy population in place.
Thank you for that, Kate. Councillor Baker, you had a question.
Thank you, Chair. I mean, given that our wonderful, illustrious government are seen to be removing scrutiny at every single opportunity they can, and we heard that the latest plans are to remove Health Watch and put it in under the ICB, I think that whatever scrutiny we can do is very much needed. And I'm very much aware, though, that we have to build it into our committee's work plans and also our committee meetings, which are limited in time. So to that end, my ask to the committee would be that when we do bring in outside partners, that we, if possible, twin it in with relevant committee agenda items, because I'm quite aware that we bring in people to speak to us, and then we only get about 1 or 2 answers out of them, given the time limited. So just that's my ask to the committee, Chair.
Thank you. I'll take that under advisement. Thank you. Talking about that, we have got some time well, we need to make a vote on this proposal first of all. So basically we'll be voting on it for a second is that the structured approach to statutory health scrutiny within the adult social care, public health and housing needs committee be adopted by including a standing health scrutiny item at each meeting and providing a development of a forward work programme aligned to key health priorities, system risks and the areas to identify inequality, and that the continued and strengthened engagement with the external health partners, including the Integrated Care Board, ICB, NHS providers and the voluntary sector organisation be endorsed to ensure effective accountability for service delivery and outcomes, improved transparency in the system-wide decision-making and better alignment on local priorities with wider health system planning, and that the regular updates be brought to the committee on the impact of scrutiny activity, including progress against recommendations, improvements in the service delivery and access and emerging risks, pressures within the local health system. Could I get a proposal for that? Councillor Blake and a seconder.
I'm happy to second that, but Councillor Garrett.
Is it sorry. Okay. Okay, thank you. I'm just mindful that we haven't got much time, and that's if you can ask the question, that'd be brilliant.
Thank you, Chair. One of the things that contributes to good health is having a good estate for our health services. The hospital lies within my ward of Parkhurst and Honeyhill, has some ambitious plans for development that had set out a few years ago. The area itself, it has a significant amount of development proposed for it in the draft planning strategy. And that it would be welcome if the committee could actually look at the estate planning side of health delivery, and also to see if health providers, the 2 trusts that deliver services on the St Mary's estate, and here I will declare an interest that my partner, my husband, is a nurse working for Portsmouth Trust, delivering a service on the Isle of Wight, to ensure that the estate is providing fit for purpose accommodation for the delivery of those services. So with the potential of the adoption of the draft planning strategy, within it, the commentary around a supplementary planning document for master planning that part of Parkhurst and Honeyhill, it would be very helpful if the committee could find a way of scrutinising the estate side of things, because that does have significant implications for healthcare.
Thank you. I think it's important that is brought up within the next corporate management meeting, so we can get this onto the agenda. It's something that we were discussing earlier on, but thank you for that question. It's an interesting way. Yeah, an interesting one. Shall we get this accepted? So we've got a proposal, we've got a second. All for, everyone for. Thank you. None against. No. Okay, on to the scrutiny. Hand over to the officer. to give us an overview on. Sorry, there you are. Thank you.
Thank you, Chair, and good evening to the committee. I'm going to say a few opening words, and then I'm going to hand over to my colleagues from the National Health Service. So we're talking about special educational needs and disabilities and children who have special educational needs and disabilities. So how many children are we talking about? So on the Isle of Wight, we have about 24,000 children between the ages of 0 and 18. And we have about 33,000 children, young people and young adults between the ages of 0 and 25. And the reason we go up to 25 is because the law says that statutory duties relating to special educational needs and disabilities go up to 25. We have on the island about 5,000 children and young people who have some kind of identified special educational need and disability. So 5,000. About 3,000 of those are supported in the community by their education provider. They do not have an education and healthcare plan. About 2,000 of them, a bit over 2,000, do have an education and healthcare plan for their needs to be met. And that means that their needs would not otherwise be met through what was otherwise available. And the council then has a duty to conduct an education and healthcare needs assessment. And if it judges that an education and healthcare plan is required, then it will issue an education and healthcare. So we're talking about 5,000 children and young people who have special education needs and disabilities. Under the SEND Code of Practice, which is the statutory framework which dictates how statutory bodies should support children and families with SEND, there are lots of different organisations who have statutory duties. So they include earliest providers, nurseries, schools, secondary schools, primary schools, colleges, etc. But there are two organisations that are responsible for leading provision in local areas. And those two lead statutory agencies are the council and the Integrated Care Board, i.e. the NHS. But importantly, this is not something which any single organisation can deliver to a high standard on their own. We have to work together as one team across organisational boundaries in the shared best interests of children and young people. And that's why I'm sitting here with colleagues from the Integrated Care Board who lead on SEND provision on the island. The third thing I was going to say is that this is a very exciting time for all things to do with special education needs and disabilities, because government, after many years of pondering on what needed to happen to improve the quality of services for children and young people with SEND and their families, has announced a whole raft of policy changes, commonly referred to as the SEND reforms. And we were written to in February by the Secretary of State from the Department for Education and also from the health equivalent to instruct us to take things forward with progressing the development of a SEND reform plan for the local area. And I and colleagues from the NHS and colleagues from across the island and parents and carers have been involved in developing a reform plan. And that was submitted to the Department for Education last Friday and will be subject to an item at next week's Children's Services, Education and Skills Committee. But the purpose of this session is to think about the health element of that SEN support. So that's why colleagues are here from the NHS to give you a presentation and then answer questions on how health provision for children and families with SEND is provided.
Thank you. Sorry, I should have put that on first. I'd just like to share some slides with you. So thank you. Just carrying on where from Ashley, thank you for introducing that. Is how the ICB are working with the local authority on the reform plans to improve that early identification and needs-led support to strengthen our integration across education, health and care, and to continue our positive working relationships in improving the outcomes for our children with SEND. This will reduce reliance on our specialist high-cost services and improve family experience and system navigation. So locally, we have been working jointly with the local authority to produce the reform plan, and we will continue to work with them to then evolve the plan and deliver over the next 3 years. The plan is co-designed and jointly owned by our system partners, and the plans will release funding to cover 90% of the council's SEND debts once it is approved. The ICB are accountable for the joint leadership of the SEND system with our local authority partners. We strategically commission the health services for children with SEND, well, for all children, but obviously this is in relation to children with SEND. We have integrated service delivery across education, health and care. As I said previously, we're participating in the formal governance and the delivery of those reform plans, and our aim is to improve that early intervention and outcomes. So the shift is from a supporting health partner to that co-accountable system leader for SEND delivery and outcomes. And this aligns with our NHS 10-year plans and the ambition in there for the early intervention. Children's therapy performance on the island. So physiotherapy, the referral to treatment time for any of our therapy provisions is 18 weeks. The current waiting times are just over 3.5 weeks for physiotherapy, 13.6 weeks for speech and language, and 13.8 weeks for occupational therapy. Physiotherapy is strongly performing. We appreciate that there is a pressure area in speech and language, with the healthcare trusts being at 11.2 weeks and the island being slightly higher. So we've recognised that and we'll be working towards reducing that. And with occupational therapy, there has been significant improvement. So from our Q4 data for 24-25, it was at 27-week wait. That's now been reduced by working with our health provider down to 13.8 weeks. So we will continue to monitor that and to ensure that continues to have that positive trajectory. Long waits have been eliminated. So for any of our therapy, there is no waits over 36 weeks. The proof is no children waiting over 36 weeks. Wait times for all of our therapy services have improved from previous year. And as I said, the occupational therapy wait list has reduced from 27 to 13.8. There's development across the ICB footprint of a children's therapy specification that will be an updated delivery model. And this will work alongside our SEND reforms plan and the expert at hand early intervention model. There's a development of a speech and language pathway across the whole system so that we can have that consistency. And on the island, there is a development along with the Best Start for Life programmes around speech and language group placed provision for those children that are low prioritisation. So they may not meet the specialist provision, but they do require some support and intervention early on to enable them to reach those good levels of development. Our therapy provision is based on outcomes rather than the predetermined number of weeks to wait. Our CAMS data, the average wait, this is child and adult mental health services. The average wait for the island is 3.9 weeks and the average wait for the Isle of Wight service is 4.6. And the island is performing much better than the rest of our city footprint. Overall, our wait times have improved compared to the previous year. And there are more accessible early intervention programmes, which include Back to Basics, My Happy Minds and COOF, which are online digital offers. All of our services on the island are provided by Hampshire and Isle of Wight NHS Foundation Trust. The main part of the SEND reforms that the ICB holds that joint responsibility for is the expert at hand offer. And this is an approach to early identification and support, which includes our educational psychology, speech and language therapy, occupational therapy, and that's social, emotional and mental health support. This will enable us to provide an inclusive system that needs are met regardless of diagnosis and at the earliest point. And the aim of the reforms is to have that reduced escalation and demand for those specialist services. The other data that we report on for our senior spectrum is around newborn screening, and on the island this is performing well and all children are receiving their tests within the allotted timeframe. Thank you.
Thank you very much. We move on to questions from the committee. David, Councillor Owen, thank you.
Thank you. I may have missed something, but could you explain how the waiting lists exactly have been brought down, please? What are we doing differently that's allowed those weeks to come down? Thank you.
Thank you. Yes, so the work within the trust has been around that caseload cleansing. So looking at children that may have been on a wait list, on the caseloads for a long time, but may not be actively receiving therapy intervention at that time. So it's looking at where are they being supported, where's those needs best being met. That's some of the way. And then looking at how the system generally offers that appointment. So looking at need opposed to, so that those with the highest need get seen first, and that they are seen once and assessed once. So it's that integrated, joined up working along with that caseload cleansing and being really clear as to what that offer is.
But just to follow up as well, there's an active waiting list management system that the Hampshire and Isle of Wight Healthcare Trust have put in place, which means on a weekly basis they're clinically reviewing prioritisation of children and young people, so bringing forward those young people whose needs are increasing. What they've also done is restructured the way in which they've designed services. So rather than giving children pre-designed packages of 8, 12 or 16 weeks, they're now working with children for as long as they need. For some of those children, it's meant that they're not on our caseloads for as long as they previously had been. There's a whole range of much more proactive work that's happening. There's also very small but emerging evidence that the impact of the family hub programs are slightly reducing the increase in demand for specialist services, which is also helping the wait list. So there isn't a silver bullet that's reduced those wait times. There's a whole number of things that the Healthcare Trust have been doing really well.
Just one question following on from that one, if you don't mind. With adult social care, something that was picked up in the CQC was focusing on the strength-based approach when dealing with the reporting system with regards to children. And we mentioned the reporting system earlier on. What is it that we're doing with children's services and reporting system based on that? Are we doing the same approach, or have we gone down a slightly different route on that one?
So as part of the SEND reforms, one of our commitments in the coming months is to develop a new multi-agency performance dashboard. So we will agree that with partners about which metrics we will use to measure the impact of the changes in work that we'll be doing over the coming months. And that includes measuring the impact of the new resource that's coming into the system. So for example, as part of the SEND reforms, the island has been given £847,000 to spend by the end of this financial year on increasing the amount of health and other provision within mainstream schools. And we anticipate that that will have an impact on children's outcomes, and that less children will then need to have that higher level of intervention. That money will be spent. We've got a plan about how it will be spent across additional educational psychology, speech and language therapy, occupational therapy, but also specialist teacher outreach into mainstream schools. Just with regard to the strengths-based approach, it is absolutely the case that in children's services and also in the NHS that we focus on the strengths and capabilities of children and young people. That is the focus. We believe that everyone has the opportunity to fulfil their potential. And we start off with identifying strengths. We then look at where there might be areas of worry or concern, and then we agree what we're going to do to build on those areas of strength to address those areas of concern. So a strengths-based approach is definitely something that we promote and use within children's services.
Thank you, Councillor Block.
Thank you, Chair. That's good news, actually. That's, hopefully that'll lead to a bit of early intervention as well, which is always a positive thing. A couple of questions. The physio, is there a priority for children given above adults? Is there some protected characteristics? Because 3.4 weeks seems quite quick to me compared to anecdotal evidence of people trying to access physiotherapy through the NHS. And another question just around the staff recruitment. Are we on track to be where we need to be for staff recruitment? Have we got the money, etc., and the applicants that we need to get to where we want to be?
So there isn't a particular prioritisation of children's physio over adult physio. They're separately funded and structured. The low wait lists and speedy points on the island are as a result of the significant work that the team have done to reduce those and be responsive. What I would just like to point out is the wait lists are the referral to treatment times the NHS manage. I am aware that there's quite a lot of feedback from families that doesn't necessarily give us the same kind of narrative. So we've committed as part of the Integrated Neighbourhood Working Programme to really engage with families in a very different way so that we can triangulate those data alongside the kind of the lived experience of what families are telling us, because those two things don't quite kind of balance. So the data looks really good, but some families are telling us that access doesn't feel as good as the data shows. So we're going to do some work as part of our integrated neighbourhood working to do that. In terms of workforce development, there is a national challenge around speech and language therapy and particularly around occupational therapy. There are not sufficient numbers of colleagues going through the training programmes. As part of the SEM reforms, there'll be a senior advanced speech and language practitioner appointed who will cover the ICB footprint. He'll be responsible for workforce planning and for engaging with universities to try and increase the opportunities that we have through those for apprenticeships and for the master's qualifications that those staff need. There'll also be some work done around a call to arms to look to bring back into the public sector lots of colleagues that have left for various reasons who are no longer practicing or have moved back into private practice. That showed some really great results when it was done with public health nursing probably about 10 years ago. And we're really confident that that similar approach will help us. The other commitment specific to the island is a real grow your own approach. So really looking at how we use the skills of people on the island, regardless of their qualifications and those natural skills that people have. I'm really looking to develop the apprenticeship programs and those less traditional ways into the qualifications. There are lots of benefits of being part of the big ICB commission across the whole of our footprint, but that water is always a challenge and will continue to always be a challenge. So the significant answer for the island is that real grow your own. We just haven't been very good as a system at starting people kind of at grassroots and building them through. So there's a commitment in this plan to start doing that.
So linked to that, an example of what is happening is when I met with the island head teachers last week, and we were talking about this, and we were talking about the fact that there are some schools on the island that are actually reducing their workforce because of the declining number of children who are accessing our schools, that there are colleagues there who've got brilliant experience, brilliant skills, and a real commitment to helping children and families. And there are opportunities for those colleagues to retrain in other professions, whether it be speech and language therapy, physio, occupational therapy, educational psychology, and indeed social work. So I will be writing to all schools before the end of the summer term to advertise that opportunity to all school colleagues, basically, so that if there are schools who are going through that change process, that we retain those colleagues within the wider children's workforce, even if they're doing something slightly different. And just a little, if this is a follow-up question.
It is. Thank you for that, Ashley. I mean, obviously, it'd be good to keep the talent we've got on the island here rather than going off. Would it help if we were able to secure some student accommodation on the island to attract people to permanently base themselves here to develop their learning rather than having to commute across from the mainland?
And certainly that's something that's been reviewed for some of the children's services, is whether accommodation that's more affordable on the island is a good way forward. I wouldn't like to commit to that being the answer here. I'm certainly happy to report back to board at an appropriate point with some plans about how we'll take some of that forward, but it's certainly something that's been viewed.
Just Councillor Richardson, and then over to you, Councillor Lee. Thank you.
Thank you. One of the early slides, it mentioned that 90% of the costs would be covered of the needs here, I think. So what about the extra 10%? And also if there's overspend, how are we going to cover that? Thank you.
I'll answer that. So this is quite a big, complicated topic. So essentially, the council has money to meet its statutory duties relating to special education needs and disabilities via what's called the high needs block of the dedicated schools grant. The council has been spending more on meeting its statutory duties than it receives from government to do so for many years, more than 5. This means that the cumulative debt within the dedicated schools grant is currently, well, at the end of last financial year, it was about £17,100,000. That is currently ring-fenced from the council's wider balance sheet by a thing called the statutory override, which means that it doesn't contaminate the council's wider balance sheet. Government is in the process of changing the way that special education needs and disabilities are funded nationally. They have said that in about in 2 financial years' time, they will be centralising SEND funding, but we do not yet have clarity about what that will look like. In the meantime, what they've said is that when we review your SEND reform plan, which was sent in last Friday, if we decide that that is fit for purpose, we will pay you a new grant, which is called the High Needs Capital Stability Grant or something like that. And that will equate to 90% of your cumulative overspend in your DSG as at the end of last financial year. So 90% of 17 million-ish is about 15 million. So the council will then receive 90% of that and it will be paid in the autumn. If the SEND reform plan that was submitted last Friday is deemed not fit for purpose, we will not receive that money straight away. We will have to improve our SEND reform plan, resubmit it in the middle of November, and if it is then fit for purpose, we will then receive that high needs stability grant later on in the financial year. And what government has said about future years is that they will adopt a similar approach for the next couple of years until such point as government centralises this SEND spend in a way that we don't yet know how that will look. To put that in context, in the light of those changes, when the government allocated local authorities high needs block grants for this financial year, it was flat year on year compared with last financial year. So it didn't account for any increase in the needs of children, and it didn't account for anything to do with inflation. And what that means is that because the needs of children continue to rise, the number of educational healthcare plans we have goes out about 10% a year. The current in-year forecast overspend on the high needs block is about £12 million in 1 year. So what our assumption is that in subsequent years, we will receive the high needs stability grant, which will pay off 90% of that as well. But there is a degree of uncertainty about how that will work. I hope that explains that financial context.
I hope so, Ashley. Do you feel like this is actually going to meet the needs of it and solve some of the financial issues?
So the principles within the SEND reforms, I believe that they are absolutely rooted in sound principles. There is some nervousness amongst certain groups of parents and carers about whether the changes that are proposed related to education and healthcare plans will be in the best interests of children. And there are also concerns amongst some groups, including some schools, about whether the ambition, which is displayed in the reforms relating to improved inclusion in mainstream schools, are realistic, about whether schools will actually have the capacity to do what is being asked of them by government. So there are some concerns about that. And if you have time to read our SEND reform plan, which is 146 pages long, you'll see in there a risk register with the 5 biggest risks that we have around that within there. So yeah, there are risks, but I do think that the core principles of it, which are around early identification, early support, and prevention of escalation of need, are absolutely in the best interests of children. And if that works, it will also result in better value for the public purse.
Thank you. Got any more follow-up questions? Councillor. Just hold on a second. It looks like we have an issue with the microphone.
Thank you. Thank you, Catherine. Thank you. Yes, I've got 2 questions. Really, you did raise about the areas of strengths, and you did about that actually a lot of children are not academic. They have other skills, like in sport or art or doing things with their hands, right? And you did say a little bit about apprenticeships and so. One of my concerns is that it's often the opportunities outside the schools which actually give those opportunities. We, back in 2017, cut universal youth services on the island, and now we have a bit of a postcode lottery in those services, and often it's those youth services that provide those other activities, particularly things like D&E, which is the Duke of Edinburgh Award scheme, which is very successful on the island. But if you live in certain parts as a young person on the island, you don't have real access to those opportunities. So we do need, how do we engage with the voluntary sector, with the parish and town councils are providing some of the youth services now, to actually make sure that we have got all the young people on the island that have the particular needs, have those opportunities, and we recognise that. And my linked question to that is, often, this has been my experience, and perhaps it's controversial, but often whoever the parents speak loudest in the past and have advocated very strongly and very professionally have got the needs for their children. But often the families who don't have that, the poorest on the island, they don't have that voice of advocacy to actually get the services needed. And I know as a councillor, I've advocated for a number of families in this regard. How are we going to make sure under these new reforms that, one, there is outside of school hours opportunities that help those young people, and 2, that there's inclusivity, that the poorest families that are in real sort of needs, that don't have access to perhaps funding to do other activities, get the support they need, because they haven't got a voice at the moment.
So I guess the main focus of this item is about health. So you're talking about health inequality. Okay, so I've got some things I can say. I don't know whether health colleagues want to comment on out of school hours provision or working with the community and voluntary sector with a health lens on it, and then I can talk about it from a broader perspective and around health inequalities.
If we can maintain the answers to the relevance of the agenda, that'd be marvellous. Thank you.
Okay, so I'll answer it. So I would say that the first element of it, one of the things that I was really encouraged by when the government announced the Schools White Paper, Every Child Achieving and Thriving, which was published in February, is that it talks a lot about the change of education and the role of a school as an anchor within its community. It talks about education should not be about what happens between a child arriving at a school gate at 9 o'clock and leaving at 3 o'clock. It asks school leaders to think about the role that a school can play in its wider community and the impact it can have on the wider community. So I think that is absolutely in line with what you're talking about. So because if you think about it, if you add up the number of hours that a child is actually in a school between 3 and 9, and you take out weekends and bank holidays and holidays, they spend a lot more time out of school than they do. And we need to be cognizant of that when we're designing services. So the expectation from government under the SEND reforms is that school will play a wider role in their communities that they serve, and they will do more than just deliver a 9 to 3 offer around an academic curriculum. They also talk about rethinking the curriculum relating to what you said, that not all children are academic, and actually Ofsted are very alive to this, and they're looking more broadly in their inspections around what schools are doing to meet the needs of all children, not just the most academically able. So I think that's really, really encouraging. So what else are we going to do? So you'll be aware that we have a partnership arrangement on the island, which we set up in summer 2025 called Together for Children. And just a couple of weeks ago, we held the second annual conference of Together for Children. And we bring together community and voluntary sector groups from across the island who work to support babies, children, young people and families. And that is exactly about what you were talking about, so that we bring people together, we think about ourselves as one island workforce, we break down the organisational barriers, we share information, we share opportunities, we identify challenges, and we work on solutions. So the Together for Children partnership, I think, is growing, is strong, and is having a positive impact. And the reason we had a second conference is because people who attended it said it's valuable, we'd like to do more of this. So that's an ongoing thing. The third thing about your first question is linked to what Anthony said earlier about speech and language therapy and family hubs. So we have a good family hub network on the island. Through the SEND reforms, we have some money to put an additional SEND specialist into every family hub. And we want to make those family hubs not just focus mostly on younger children, but actually of adolescents as well. So they can be a community hub as well, which will be open for longer hours than schools are open as well. And we need to make sure that the SEND reforms interface with the Best Start in Life programme, which is one of the other government's key flagship programmes, but also the Family First Partnership reforms as well, because there's a lot of synergy and overlap in this. And one of the bits of common ground is early identification, early support, and the prevention of escalation of needs. So that's real common ground. In terms of equality and social justice, which I think is what you were talking about, and which is why lots of us come to work every day, what we are doing is reviewing our decision-making processes around how we allocate out resources. So you will be aware, I think, that we've made considerable changes to the way that we run panels around education and healthcare plan needs assessments and the issuance of plans. We've reviewed the terms of reference and how that decision-making is done, and I'm confident that our decision-making is better than it was 9 months ago, and we'll continue to review that and work with colleagues in the NHS and social care to make sure that those decisions are based in statute and that there is fairness in the way that public resources are allocated as a result of that. In addition, I mentioned the additional money that's coming in for SEND reforms, which is the £847,000 for this model, which is called Expert at Hand, which will be allocation of resources on speech and language therapy, occupational therapy, physio, EP, etc. That will be run by a multi-agency panel, which includes health, social care, and also colleagues from schools. And they will be the people who decide how resources are allocated in a fair and equitable way.
Thank you. Thanks very much. So conscious of time and the fact that we've been sitting here for nearly an hour now, I can take one more question from the committee if there's anyone going to more questions for that, and any non-member, any members not part of the committee. Yes, thank you.
Thank you. I've got a quick question. I don't think it was mentioned, but we're contacted by lots of parents really concerned about significant waits for ADHD and autism diagnoses. And some parents have contacted us saying that they can't even get on a waiting list at the moment, and they have no idea when they can expect a diagnosis. So have you any plans to resolve this issue? Thank you.
Yeah, absolutely. We're acutely aware of the challenges. They are national challenges which are being managed in different ways in different areas. There are no reasons that children and young people shouldn't be able to join waiting lists. So I'm really happy to receive any information about families that have been told that they can't join a wait list. That's absolutely not the current process. I'm really happy if you want to share some of that information over with us. In terms of the work we're doing, we're working jointly with the local authority and have launched an integrated neurodiversity multidisciplinary support team, which is working with schools and with families to look at supporting children and young people with their needs regardless of diagnosis. That should help to manage some of that wait list and that referral mechanism. That doesn't change the need for children who are diagnosed with ADHD and require medication. So we're looking at how we might progress that at a faster pace. We will be launching in the next month or two a new triage hub. So all of our neurodiversity referrals will go through a screening triage hub before going out to our providers. That will achieve a number of things, including a reduction of our current wait lists, because we have a number of children on a number of different wait lists in different organisations. We think there's probably a 20% reduction in the size of our wait lists just by cleansing them through our triage hub. We are looking to pilot a slightly different approach on the island as well, and are looking to work with a primary care network to see if there's a different community-based solution to some of the ADHD work. And then finally, we're looking at the shared care arrangements, which will allow consultant-led prescribing of ADHD medication to be shared with local primary care colleagues, which doesn't currently happen, which means all of our consultant colleagues are continuously looking after children on caseloads just for medication, which shouldn't need to happen. If we can move that, that will also release capacity. So again, not a silver bullet, but a number of things which, if put together, we can see nationally are having an impact positively.
Thank you very much. So we come on to recommendations. I'm going to put it to the committee if you have any recommendations that we need to move forward with regards to that briefing and the chat we've just had over the past hour. Move to you.
I'm happy to put forward a recommendation that we as a committee note what has been presented and seek, once you've implemented the reforms, that you actually come back to the committee so that you can actually report on outcomes, right? And where things are working right and where things are working wrong. I look for a second then.
I second. Okay. I'd like to put that to a vote then. So any for? Against? And no abstentions. Abstentions. Right, it's now coming up to 6 o'clock. I recommend we take a 10-minute break. Everyone to be back in here. If you back in here for 10 past, if you're finished with your presentation, you may leave, but you're very welcome to stay on if you wish to. Thank you. Welcome back, everybody. I believe that's everyone back. Thank you. So next item on the agenda is 7A, the independent sector engagement home care. I will now hand over to Laura Gideon. Thank you.
Thank you, Councillor Wheeler. I am presenting this report initially, but opening the floor to colleagues from the independent sector. We're joined by Sarah in the room and by Stephen online, both of whom are senior people within our home care marketplace, responsible for 2 of the 3 prime providers who deliver domiciliary care on behalf of the local authorities contract. By way of background, this item is on the agenda as one of a series, and you'll be meeting partners from different parts of the independent sector over the course of your next 4 meetings. The request came directly from the sector as a result of our annual fee setting process and a real interest in ensuring that councillors were aware of what the services do, who they work for and how they deliver to vulnerable people in our communities. My team have prepared a report that's before you and has been published, which sets out some of the key challenges that are faced by our home care sector across the island, and Sarah and Stephen are here to speak to that in more detail. I know both know their business incredibly well, and we're very fortunate to have them partnering with us to support people who live in the community in their own home with eligible care and support needs. And I know that they'd only be too delighted to answer any questions that you've got. I'm happy to answer any questions on the report or the appendix that's been provided to you, but I propose to take up very little of your time and to hand over to the true experts, so to Sarah and to Stephen online.
Thank you. Sarah, would you mind? Thank you.
I can talk loud enough, I don't need a mic. We are one of the 3 prime providers on the island. And as a collective of the 3 prime providers, we are providing 10,000 hours of care. We've got a suite of carers that work for us, and part of that contract is that we subcontract 30% of the work that comes through us from our brokerage system to other subcontractors, which allows us to share that work with all of the local care providers within the areas that we work. We work with a lot of different disabilities, a lot of different illnesses, and we adapt what we do to try and make people as independent as possible and allow them to stay in their homes for as long as possible, in the hope that their homes are their forever homes and that we can adapt the care that we provide to keep them there right the way through. I don't know if Stephen wants to add anything to that.
That was, well, hi there, I'm Steve Trowbridge. I work for a company called First City, and we are a provider in the northeast of the county. We actually subcontract within the contract. We can keep, or we can work with many people, up to 70% of the market share of our own customer base. However, we like to ensure there's a vibrant market behind, so that we can meet everybody's needs, and we can be very reactive when it comes to getting people home from hospital with the right care at the right time. We've got a workforce that is a difficult workforce on the island. I know we've talked about to the council many times on how difficult it is, the workforce. Workforce itself, we've got an ageing population on the island. The workforce is an ageing population. They're predominantly care workers who are minimum wage or close to minimum wage, and they're finding things really tough. I've got a few things, some of my staff and some of my partners, and when I say partners, they are my partners, and they're the subcontractors who are within my supply chain to provide the services for the people in the island. And we contract around 90% of the market to our partners, and we work around 10% of the marketplace at the moment. We're subcontracting around 2,500 hours of care a week, and we're delivering ourselves around 700 or so. I think that's about right. So the market itself on the island, as I said, you're probably all aware that the problems we have with the hospital. We've got one of the worst, or one of the hardest situations in the country around, because we've got a body of water around us. It's really difficult to make sure we've got enough workforce. We've got a hospital that's really difficult to get people out, and individuals can be fairly risk adverse around whether home is the right place for them. And I think we've got a really good opportunity at the moment to change things on the island. So individuals, if they feel comfortable and are able to provide care in their own home and meet their needs, home's the best place for them. But it's complicated to get the care at home. You know, you've got to get your medication involved, you've got to get the transport from hospital, you've got to get the therapists. There's a lot more work at the front end to make sure that person can go home safely, and sometimes more convenient to put them into a care home, if that makes sense. I'm not saying that's the right place for them, but there's a number of occasions where we know that individuals have gone to care homes, and is that really ideal? Family members love an individual going into a care home because the whole environment is contained, but the best place for individuals is in their own home, provided with care that meets their individual's needs. So I'm here today to answer any questions that you've got. It would be great to, let me just go a bit further around some of the difficulties that we face as providers. We know it's really difficult for the councils. We know that local government are asking more and more of local authorities. They're asking them to spend more money in other areas, the money they haven't got. We know that the public purse is under so much pressure around all the other services. But meanwhile, adult social care is a big chunk or big slice of what you're funding. But it's not the cost of social care is the problem. It's the cost that are going up year on year. So if we look at national minimum wage over the last 4 to 5 years, that's gone up in a higher amount than what actually the local authority is able to afford to fund. So we've had an erosion of our fees. My margin's around 5%. 3 to 5% is where I am. I've been always happy to fully share my figures with the Isle of Wight Council or any council, and we're happy to share and work with councils to understand how much it really does cost to provide services. And it's important that I'm not making a lot of money, but I'm making enough to be sustainable and to do what I'm doing. That's what I'm here for. So one big problem we've got at the moment is central government increased minimum wage. Rachel Reeves, in her wisdom, a couple of weeks ago, said that care providers should be paying 55p for mileage. That's great. All my staff and the staff across the island saying, we would like 55p, Stephen. And I'm going, well, that's going to cost me £40,000. I'm only making 100 hypothetically on the island. That's not going to work and make sure that I'm there to be sustainable. So if you look at the way things are working, it's really, really difficult. And we then knock on the door of the local authority and say, can you fund higher rates for us so we can pay directly pass on to our staff? And I know that's a really difficult conversation to have because the budgets are so tight. So central government isn't properly funding adult social care. We know that. We also know the island, over the last few years, we had some extra money. They've taken that away from us. It's even harder for the island. So we need to look at doing things differently on the island, and we need to make sure that we're sustainable. It's difficult to recruit. I know if I put my rates up, pay rates, I'm really worried that we're competing against hospitality, and they put their rates up. So it's chicken and egg. We can't keep doing that. What we need to do is be looking at our workforce. We need to be looking at opportunities, development. We need to be keeping young people, hopefully on the island, to come and work in adult social care. But it's really difficult. In the last 3 months, I've probably only had 6 or 7 people apply to me. We advertise a lot. We spend a lot of money on advertising. It doesn't work. And my partners, my subcontractors, have the same problem. And just to say one of the things or two from my staff, they're noticing indirectly the cost of tyres. You probably know it yourself. They're going up more than inflation. Fuel is going up more than inflation, 22% so far since January. Hopefully it'll come down. And we've suggested that we might look at a temporary increase and how that can be supported. That's a conversation. But I'm here to answer any questions. I do believe we can fix the problems on the island by working together as a system, but the whole system needs to come together and work together. And it isn't all just about money. It's about efficiencies and working together. Thank you.
Thank you, Stephen. I just one question before I kick it off to the committee. So with regards to, and please excuse my ignorance in this, I know you're a subject matter expert. With regards to encouraging local business, local people, I'll give you an example from my ward specifically. Central Rural has the same population as Ryde West. However, it's spread over a quarter of the island in terms of area as a landmass. Is there any way that we can encourage the people that are already caring for somebody at home, offer extended training to potentially, where we can engage those people to help out in their community potentially as well? Thank you.
Do you want me to take that one? Yes, we do. One thing I like to do is empower individuals to look after their loved ones. I think that's really important. I think that's where we need to start and build. One thing I like to do is look at risk, and it's important if we're looking at someone we're supporting on a 2-to-1 basis, it's important that both individuals have the right skills to make sure that nobody's put at risk because the other person doesn't have the right skills. So if we're moving somebody from one room to another, the transfers, both people need to be appropriately trained. We open up our training to our customers' loved ones, whether that's dementia, so they can understand why mum's struggling the way mum's struggling, the way the family might be struggling the way they're struggling, or whether it's if from a private perspective they can't afford the care in entirety, where we look at, well, do you know what, we'll do XYZ, but we can help you do Y, and we can help you with this element, and we can train you to do so. So yes, I think it's really important that we do that, and I think it's important where we can, and this is where if we can get a different type of service on the island, and this is what I would like to see. We haven't got enough workforce, so we can't have everybody at home having care. We need to empower individuals to look after individuals, whether that's just the next door neighbour scheme and making sure that they're checking on the milk bottle at the front door has been picked up that day, and it hasn't, they've raised that alarm, whether they're in a ward assisted building and each other are looking after each other. It's about the good neighbour scheme. And yes, I'm happy to train. I think all the lead providers are happy to train individuals to help. As I said, we haven't got the workforce. So the biggest headache at the moment we have on what you're talking about there, the hospital. We had a meeting last week where there's a large number of people in hospital. They can't come home. But there isn't a blockage in the community's perspective. It's somewhere else. Now, if we were able to unblock that blockage, you tend to just move the problem to another part of the system. If we had, we last month, I think our referrals were around 3 to 4 referrals for the north east. And if we look around the rest of the county or the rest of the island, it's roughly the same for the other providers. We manage systems elsewhere. We manage the whole flow. I'm taking 30 to 40 customers a week, and then I'm passing them to my partners, and we're working with those individuals. But we also have ways of decreasing individuals' care very quickly and trying to get their loved ones to help us. So we're not there to do that. But it's important, if the person's eligible for the care, they have the care, we meet the Care Needs Act assessment. Can't do anything without a social worker there. But yes, to your answer, yes, we can do that. We need to do more of that. And we also need to look at technology and how technology can help people in their homes so they can be empowered to look after themselves.
Thank you. Did you want to follow up on that one, Laura?
If I may, Chair, just to confirm, as part of our market development strategy around meeting our Care Act duties, we've embarked heavily on supporting micro commission services. Our PA hub is one of those examples. It has in the past created friction with the domiciliary care services and home support because historically it was the same group of people servicing both. Our prime providers now are very clear. It isn't a threat to their business model. It offers something completely different and helps us as a local authority to discharge our statutory duties to promote choice and control. For a home care provider, providing care and support has to be a rotated, structured business. People have to be providing care at certain points of the day and delivering certain tasks for people. For a PA, the job is very different, and there's a level of flexibility that suits some individuals in terms of their care and support. It's not an either or, it's a choice which people are genuinely benefiting from, and we're seeing that grow. The model that Stephen's described is almost a hybrid between that PA and family carer model and the skill set that we've got in our independent sector delivering home care. So we're delighted to be working with our 3 prime providers in that space. Stephen briefly mentioned technology, and I think as prime providers, they undersell themselves in this area. All 3 of our prime providers are really committed to looking at how technology can support people to be more independent. A lower level of interference with an individual's fundamental rights of citizenship in their own home can only be of benefit for them, but not to the expense of that human interaction and reduction in isolation that some people see. So I think we're really lucky as a local authority to be partnering with all 3 of our prime locality providers. It was a long-term model, investing in that part of the market, and we're already seeing it deliver some really substantial gains in terms of the number of people who can receive care and support in their own home. That will continue to grow over the lifetime of the contract, and it will grow because of the willingness on the part of our partners to look at doing things differently that reflect the needs of our local vulnerable population.
Thank you, Councillor Blow.
Thank you, Chair. as mentioned before, I mean, there's a lot more dignity for some people to be cared for in their own home. But equally, a challenge to that is if they feel they're reliant on family members, they equally want some dignity away from that, because that they don't necessarily want their children, for instance, doing some things that the traditional carers may do. So part of that, I understand, that obviously you mentioned bringing technology into the home. So what types of AI technology are you looking at? I understand that simple things like an Alexa can take the job of someone having to come around to turn the lights off, for instance, which would save some carers. But what levels of AI are you looking to bring in, whilst also maintaining that human contact? Because a lot of individuals on the island are isolated, despite the fact they are surrounded by people. And typical on the island that a lot of the housing types are very similar. So old people tend to be surrounded by other old people that are housebound and aren't able to have that community help all the time.
Thank you, Councillor.
I take this one, Stephen.
Yeah, go for it.
So we are very lucky to have our own technology team. We use AI in a lot of the reporting that we do in the business. We use it for parts of our recruitment. We use it for collating information from the carers reports to the social services risk assessment. We use a tool for the field care supervisors to assist them to write care plans that are really person-centred. So that is in the form of an app that they use while they're doing an assessment. So they're not having to type or write, they're having a one-on-one conversation with the person that they're assessing and understanding their needs. And the app then uses that information to populate and find the associated risks. And that's quite a skill for our teams that use that app. It does need a lot of training, and it's very much about the information that they put into it, like anything that we do. We're also very lucky to be piloting a robot called Genie. Genie is an assistive technology that supports somebody's care package. So it acts in between care visits. It acts to support a care visit, and it's very much a prompt device. It is in the form of a tabletop robot, and it has a screen. It also has the ability for that person to have video calls with our branch team. It has a companion app so that we can pair people together to have that communication. And it is also people's families can have an app. It's very interactive. If they've given consent for a family member to have the app, that family member can add additional prompts to that care package. They can remind their loved one that they're coming to visit. They can remind them about hospital appointment. They can set up a reminder so that in between all of their care calls, they're prompted to have a glass of water or reminded what they're having for dinner. So it's a real aid, and we're in very early stages with it. But we are really looking for ways to develop technology to be able to support local authorities to reduce the cost, but also deliver a really sort of person-centred service still. And there are lots of opportunities around that, but it's probably quite early stages for us to delve too deeply into it without being able to support it with some data for you.
On just adding to that, and there's some, I think this is the area that I'm most excited about in where things are going. It's important that we're grounded, and today's technology is out of date by tomorrow, and that's important. Technology is expensive. A couple of things I've learned, and just some advice, I suppose. I think it's important you don't go for long-term contracts, because technology today is what it is, and tomorrow it might not be, and something might be better for somewhere else. And then you're locked into something that you can't change, and tomorrow there's something else you've seen you like. Just on top of what's just been mentioned there, we're also looking at how we're using AI to help social workers to be able to make sure they've got the people who've got the right care, and the care they're receiving supports them appropriately at home. So we generate so many notes when we go and visit individuals in their own homes, and we can see very clearly, are we meeting the aims and the objectives of that care plan? Is that person receiving the right support that meets that person's needs? Are we meeting the the support plan that's been assessed by the social workers, and then the social worker can review that plan to make sure that it can be increased or decreased. The biggest worry I've got around technology is fear, and customers or individuals in their own homes, how they might fear about technology. But say you've got an individual who only speaks Italian, I can wear a device that I can talk to that person in Italian, but I can translate it and hear them in English. And all of a sudden, you then remove that barrier, and that individual who's getting very frustrated that they can't communicate to me and tell me what they want, they can tell me because I can communicate. So technology used appropriately at the right time, and it needs to be assessed. But I do believe going forward, every customer or everybody we work with will end up having a technology support plan to embed with their technology, with their care plan. And I think CQC will push us down that path. We're not there yet, but I think that's what will happen. But I'm really excited what it can do. And if you then look at humanoids and where that might go, and with Elon Musk and those things, we might be able to help someone cook a meal and might be able to cut that hedge. But you still need the person face to face, and my carers, but we haven't got enough workforce. So we're looking at how we can do things differently by maximising what we've got. But really, really exciting, and what might happen over the next few years.
Thank you, Councillor. Through you, Chair. Thank you, Stephen, because actually you went some way to answering my supplementary there. It's just around the sort of, obviously the contracts and how quickly these things are developing. I just wonder if when we're speaking to other providers down the line, and sort of looking at Laura Bailey at this, if other members agree, is it possible to set up maybe a drop-in 30 minutes before these meetings, just particularly that this committee is largely quite new to this sector, so that we can have ask questions that maybe aren't necessarily needed to be aired in public, just to improve our knowledge, if that's possible.
Laura, could I suggest on that? I know that I'm part of the Isle of Wight Care Partnership, and the Isle of Wight Care Partnership really do want to work with the council and the councillors. I think it's really important they do. There's been a history, obviously, with the island, and I know, and congratulations to many of you who are new. I think we need to make sure that what we've learned in the past around and where we are, it's starting where we are, and it's making sure that we don't make the same mistakes as the care providers going forward. I think care providers will welcome that, and they want to work with you. And if it's okay with Laura, we can have invites to the care partnership at times, and we can integrate and do different things. So care providers will have no problem coming and talking to you. I suppose, Laura, it's just making sure you've got the right care provider, the right knowledge base, and the input that you're wanting at that time. But we can attend what you'd like us to.
Thank you, Chair. In terms of the programme, the Isle of Wight Care Partnership will be at the drop-in session for partners on Monday, so that will provide the opportunity to form some of those links. The Care Partnership represents approximately 70% of care delivered on the Isle of Wight, less in terms of percentage of providers, so they're not representative of all organisations. What we need to ensure is that we facilitate engagement with councillors and all parts of that sector. You'll have noticed dropped into your diary some trips that we're planning out into the community so that you can meet with different providers, and we can feed that all back into that programme of work as we move forward. We're working on the basis that we've got you all for the next 3 years, so it would be great if over that period of time we can help socialise some of these really key issues for local people on the island as they age, and help them to age in a way that maximises their independence.
Thank you, Laura. Councillor Lilly.
Thank you. I mean, you raised obviously the difficulty of recruiting, right? And the difficulty of retention, right? Within it. And in fact, in the report, I do notice there's 450 vacant posts as page 37. And also, that 29% are 0 hours contracts. And also on page 39, that 65% had no relevant social care qualification, right? So there's some real issues about not only recruitment, training and retention. And for me, consistency, because if you're living in your own home, the relationship with your carer or carers is extremely important. If they change, right, that can be very devastating to the person and actually lose their confidence, because part of what they need is their confidence at home to remain at their home, and that's part of the relationship. What do you need from us as councillors and this committee to be urging Isle of Wight Council to improve that, so that our residents who need this service, who want to stay in their home, actually do feel that the person who's looking after them is going to stay, is happy themselves, right? And we improve their qualifications, right? Because that's extremely important. How do we make this a profession that they want to stay in?
So everything you said there is extremely valid, and I fully agree. What would I like and what do I need? I suppose full support to my colleagues at the council officers. Laura and her team are phenomenal at what they do. They're trying to balance everything between everything. We're here to do a job, but we do have problems. For example, we look at continuity and making sure customers receive the right person, the same person on a regular basis. Come the summer months, because hospitality can pay more, we tend to lose staff to hospitality, and then they come back to us for Christmas. And it's a cycle that we'd like to break, but it comes down to, I suppose, we need a plan, a workforce strategy that works for the island, that pays a fair wage for what individuals receive. But on the island, it's 10 times harder than anywhere else in the country, because you've got that moat of water around you. So it's not easy to keep and retain. And then the other problem I've got, which is really worrying me, is the aging of our demographics of our workforce. And we're not getting the youngsters through. There are a few schemes coming forward around how we can get youngsters into care work and trying to hopefully attack some of the needs, and so they come and work for us. But it's difficult. We need a fair pay. You know, if you look at today, staff are going in and out of visits in the rain and the heat, in and out of cars, they burn themselves on the buckles. Then they're trying to, within the 30 minutes they've got to have a rapport with a customer, do everything we're asking them to do, all the CQC regulations that they're expected to do to make sure that that is fit for purpose and it's safe, and they've recorded everything so then we can assess and make sure they're doing the right job and the right thing. It's hard being a support worker. It's not an easy role. Come next year, I think it's really important to mention, central government are looking at having a board that decides what care workers should receive. So there'll be a minimum wage for care workers recommended by government. At the moment, the funding amount, they're suggesting 500 million for the whole of the UK. It's not enough to be able to achieve what they're hoping to achieve. And they're going to be leaving councils like yourselves into a real difficult position about how they fund that. And so when it's looking at what you need to fund, libraries, the schools, everything else you're doing, it's going to be squeezed further because the funding's not there. So we've got to do things differently. We got to work with you as a partner and assistant partner, and care providers need to be looking at doing things differently and new ways of working and trying things differently all the time, if that helps.
Thank you, Stephen. I've just got a quick follow-up from Laura, and we'll go. Did you want anyone else having a follow-up question from the committee? Okay, thank you.
Councillor Lilly, I wanted to respond directly to your challenge, I guess, in this space. And I think there are two things that collectively, as the local authority, me as the statutory officer, you as our councillors elected by your wards, and as people who all pay our council tax on the Isle of Wight anyway, can be doing. Firstly, I would urge most strongly everyone to recognise care work as a profession. We are so lucky to have such a dedicated and committed workforce in this area who go above and beyond every single day of the week. There'll be people today who can work from home because the weather's inclement and a bit too warm for them. This cohort of folk will have been out in their cars pretty much all day, driving from one house to another house to another house, making sure that the most vulnerable folk within our community get the support that they need. So my first plea is please recognise this cohort as a profession. You all got your care badges, Councillor Blake just showed me. Please wear them and wear them with pride, because it really is an underrated profession across the island. And with over 3,000 people working in this sector alone, it's a big employer for us also. My second request is when you're talking to young people, when you're talking to people who are considering a second career, and adult social care is my third career, I came to it a bit later in life, make sure that you emphasise how rewarding a career in care can be. It isn't, as it was when I was at school, that the comment made by my teacher, Laura, if you don't pull your socks up, you'll only be fit for a job in care. Care is the pinnacle of what we can do as humans. It's kindness personified every single day of the week. I wish nothing more than there was sufficient funding allocated by central government to remunerate this workforce in the way that I believe they deserve to be remunerated. That's a whole different argument. But within our direct control today, recognise care as the profession it is and actively encourage anyone who's thinking about a new career to consider care as perhaps one of the most rewarding careers they could have.
Thank you. Okay, we have Councillor Jarman. Looks nice and cool in that office. Councillor Jarman, have you got a question for the committee, please?
Thank you, Chair. Yes, I want to pick up on the point of data, and in particular, well, to thank Stephen for his presentation, but to marry supply and demand that we were discussing. We've heard from both sides here. So breaking it down between the two, I'd like to know how many of our private sector prime providers are based on the island versus off the island, and how many employees those contracts fund on and off the island. And then a question which is either to Laura or to Stephen, part two of that.
Councillor Jarman, just as a reminder, as a non-committee member, as a member asking a question, you only get one question to ask at each point of the agenda. So would you like to choose one of those questions to ask to the group, please? Thank you.
Well, as you like, Chair. So my question then would be, given that we have roughly 3,000 working age adults receiving out of work benefit on the island, what additional capacity do each of the prime providers anticipate delivering over the next year?
Thank you, Councillor John. Please.
I wonder, Chair, if that's something we can provide a written response to. We've only got 2 of the 3 prime providers here, and it is outlined in our market position statement in terms of anticipated demand. So I wonder if on this occasion the committee may indulge us to provide a written response to ensure it's comprehensive enough to cover Councillor Jarman's request.
Yes, thank you. Any questions from non-members? No.
I propose that on the recommendation, the committee notes the content of the report and briefing paper and take the opportunity to engage directly with independent providers present at the meeting. Can I have a seconder?
Okay, then we shall go. Should we just do a nod onto that one? Everyone in favour? Absolutely. Okay, thank you. Thank you very much. Excellent. So on to the next order of business. Yes, sorry. Thank you for the independent. Everyone that's come in today. You may leave. You're welcome to stay. Thank you so much for that. I appreciate it. Next item on the agenda, 7B, Public Health Communications Plan. I'll hand over to Kate Harvey. Thank you, Kate.
Thank you, Councillor. The paper in the pack is brief, and I will keep the introduction briefer still in the interest of comfort. I will highlight just 3 things from the paper. The first being I have outlined the programme of national and service communications that we plan to amplify through public health for our local residents over the coming year. This really helps us make best use of resources by benefiting from others' investment in some really high quality communications campaigns and resources. Examples where we've used that in the past would be things like HIV Testing Week and the work of the South East Smoke Free Alliance and some work that our commissioned providers do as well. The second thing I wanted to highlight is that I've shared with committee members the bespoke campaigns that we're planning for the coming year. These are based on priority needs for our residents, but not necessarily all of the public health priority areas. They're those where particularly we feel that communications can supplement existing work and offer an evidence-based approach to improving outcomes. Finally, the third thing I wanted to highlight was really in terms of process for committee, to bring to committee today for awareness and understanding and for decision around the approval and information sharing process. So in terms of conversations between committees, there is a lot of interest in the communications that goes out publicly, and rightly so. It's a really important part of our reputation as a council and an important route that we can support our residents locally. So between committee meetings, the intent is to share campaign outlines with committee members, and also to bring for approval press releases, proactive public statements and any quotes.
Thank you. Anyone from the committee got any questions on what's just been posed? Councillor Lilly.
I just really wanted to highlight to welcome this and also welcome the strong emphasis on men's health, which is something that I've, as you know, championed for a long time. Men are 4 times more likely to commit suicide than women, and 4 times less likely to ask for help. So the more that we can do in pushing that. We also have a high number of veterans on the island as well, who also, you know, I think need support. So I think, particularly linking these campaigns, are you going to work strongly with the voluntary sector and organisations that are doing? For instance, on men, we have a very good prostate cancer support society charity that's done fantastic work on the island. How are we going to work more with those organisations?
Very happy to pick that up. Particularly thinking about the areas of priority that you highlight where we're amplifying national campaigns and linking in with others' work. So we know that death by suicide and mental health needs are particular areas in that space. We work closely through the Mental Health Alliance and forums locally on the island to make sure that we tie up the communications there. And where we have some structured partnership arrangements, we work to deliver joint communications plans. So one area there would be around our joint work around domestic abuse between ourselves, our police partners and other colleagues in the system.
Thank you, Councillor Elliott. Councillor Blake.
Thank you, Chair. Thank you for the report, Kate. I'm pleased to see, as Councillor Lilly's pointed out, I'm pleased to see the range of issues on there. One thing we did bring up last year, I believe it was in this committee when I substituted in on it, was not just focusing on smoking and more focusing on nicotine addiction being an issue through vaping and the prevalence of that, and also how that seems to be the choice for younger members of our society. Almost now smoking's pretty much non-existent compared to how it was, but vaping's now a huge thing. Also, I just want to quickly highlight, obviously, that we do things a bit beyond just these campaigns. Like just in the last minute, we've had last few minutes a notification through our council comms team about the critical incident that has just been declared due to the heat waves and stuff like that. Is very crucial for us as councillors to be disseminating around our members, our residents, because some people need to get that information pretty quickly across and don't always look at things like newspapers and stuff to get that information. So I think as a communication hub, the council has a very key role to play through not just the council, but the councillors as well.
Thank you, Councillor Blake. And just to follow on from that, what can we do as leaders to get involved in these campaigns? So I know it was last week, it was Men's Mental Health Week. I'd have loved to have got involved in a campaign. And do we have the resources within the council to provide social media video content for people to be able to have a look at? Thank you.
I think there were 3 main questions in there, so I'll take them in order, if that's okay. So starting Councillor Blake with the discussion about vaping, absolutely an area of work in the team, particularly working with schools to understand their needs and challenges, and through our Smoke-Free Island service, working to understand really young people's experiences too. So that will absolutely feature on the coming year. The second comment related to the hot weather at the moment. And absolutely, I think one of the points flagged in the paper is that some of the incident and health protection comms is very rapid and gets agreed through things like our heatwave plan that we're following at the moment. And that won't loop through committee members for approval, but is really important that we get it out quickly and cascade, as you say, through yourselves as one of many routes to reaching the local community. I think you'll be aware at the moment, I will spend just a couple of minutes on the hot weather, because I think you're aware at the moment that we have got the critical incident recently declared while we were in here, I think actually across Hampshire and Isle of Wight, on the back of the Met Office amber warning and the UK Health Security Agency red heat health alert. For us, obviously, we're involved in that public messaging very clearly. The messaging from us remains the same and very important, that we know during periods of extreme heat, we can see an increase in people becoming unwell. And what we're seeing at the moment is that putting particular strain on our health services. So the messages that I'm pleased to see communications team have cascaded again, for us again, about avoiding sun in the hottest part of the day, staying protected from the sun, drinking plenty of cool fluids, checking on others, particularly older people, the very young, and people who may have additional needs, whether it be long-term health conditions or needs for additional support. We're also including in some of our messages around cold water safety and swimming, because we know that's an additional risk at this time of year. So I think my ask would be to keep sharing those messages with residents, keep supporting through local networks. I've had some discussions between meetings around checking that those messages are reaching through the right routes. So please do keep sharing. I think we've had a fairly high coverage of messaging with our public. And the third thing, in terms of involvement in campaigns, Councillor Whelan, purpose of sharing campaigns with committee members in advance is really to be able to get your insight and thoughts on what may land well with the public, and your insight as representatives of our residents on the island. Be really helpful to get your thoughts in shaping those campaigns, and we can do that through our ongoing discussions, but also, as you say, in terms of quotes and videos for social media, and we do have that facility, and we can offer some support in that space as well as a council. So thank you. I think they're welcome offers. Well-known local faces we know are really important in transmitting messages that land well with the public. And I think that in many of your communities, actually, that's a really important face alongside our other voluntary sector reps and different community leaders.
Thank you very much. Has anyone got any more questions from the committee? Anyone from? Go for it.
I'd like to add an extra comment, because you mentioned there about water safety, and I heard a stat yesterday that in the last few days in this country, we've already had 40 deaths related to misadventure, shall we say, in water, because people do sort of push themselves a bit too far in terms of that. Whereas, and particularly on an island, we ought to be promoting that message, because we'd hate to have a similar incident happen here.
Thank you, Councillor Blake. So I propose that the public health communications campaigns plan be noted, and that the process for councillor involvement input to be approved communications through the year to be approved. Could I get a seconder, please? Can we take a vote? Unless you wanted to do, yeah, okay. Thank you. On that note, it is we finished a little 5 minutes early from that segment of the agenda. I suggest that we have 5 minutes now for a convenience break. Thank you. 7 o'clock. If you would like to take your seats again, please. Thank you. Welcome back, everyone. Welcome back in the gallery. You are surviving well up there. We should have got a fan for you, shouldn't we? But sorry. Next item on the agenda is 7C, the service performance and improvement for Q4 2025 and 2026. I'll hand over to Laura. Thank you.
Thank you, Chair. The report is one that comes to every other committee and outlines for adult social care and for public health the current levels of performance, of financial challenges and of risks. The report contains all of the relevant information around the services that I manage, both adult social care and housing. And I'm happy to answer any questions that you have in relation to the report.
Thank you very much. I'll hand over to the committee. Any questions from the committee at all? Councillor Lilly, I'm just saying that we are very, very short of time. We've got 6 items to get through over the next hour, so please keep it brief. Thank you.
I think it's always important to show some evidence that we've actually read the report and to actually looked at some of the figures. I'll home in on one particular, which is obviously extremely important to us all. The number of homelessness, page 56 on Appendix 1, right? And it under housing need and homelessness, and the figure is 257, and last month it was 229. So there's an increase. Is there is it a seasonal blip? What's behind that rise? Right?
In relation to homelessness, in relation to homelessness, it's always challenging to try and attribute the current demand to any particular scenario. Perhaps this time round it's more easy for us than it has previously been before. As a committee, you may be aware that there have been a substantial number of changes affecting private rented landlords. And as a result of that, a number of landlords have chosen to exit the private rented market sector, placing their properties up for sale and in effect making their previous tenants homeless. It appears that what we're seeing this report and for the start of next report is the legacy of those changes to national legislation that have encouraged local people to make a different decision in terms of their investments and whether or not they're prepared to be landlords for the future.
Let's ask a supplementary to that. I notice in my ward that you purchased a house to bought temporary accommodation, which I welcome. What's the level of property we're purchasing as a council, right, to decrease the number of people going to bed and breakfast?
The purchasing of accommodation has been a hot topic for the council for a number of years in terms of spend and making sure that spend stacks up and is a good use of public funding. Over the past few years, we've purchased a number of assets right across the island, the majority of which have been used to bolster our own temporary accommodation supply. We're currently in the process of progressing the purchase of Kiln Court. Councillor Bauer raised it with me outside just a moment ago to see where we were in that chain. As a local authority, we're heavily reliant on grant funding to enable us to make those purchases stacked up against our borrowing. We can't borrow specifically just to buy because financially that's not viable for us. We continue to pursue opportunities as they arise. What we don't want to do is buy up all of the housing stock that's available because then that makes it unavailable for local people to purchase their own homes. So it's a very fine balance.
Thank you, Councillor Lilly. I have one question as well, if you wouldn't mind. It's on page 85 of the report, strategic risk number 11. The failure to champion the place-based agenda within the integrated care system to ensure that the needs of our citizens are being appropriately considered within the integrated care board, the ICB agenda. You mentioned that the current pressure points of the hospital surge impacts on ability to effect timely discharge, and the integrated care board restructuring impacting on staff and resources and decision making. How are we coping with that with the council? Thank you.
It's perhaps easier to take the integrated care board restructure first. That's quite simple for us. It's a standalone organisation who will conduct their business and their staffing in the way that they choose to do so. Our integrated care board colleagues have been very keen to ensure that we've remained informed in terms of process, taking opportunities to identify early any impact that might have for the local authority, and then working with us to work out how we can manage that most effectively moving forward. So although it's a current pressure point, the mitigation activity, maintaining engagement with the ICB and continuing to review our shared care arrangements is managing that pressure for us. The first pressure point that you mentioned in relation to hospital surging and impact on demand continues to be hugely problematic for us. You heard from the providers, we're small but perfectly formed in terms of a marketplace with what I think Mr. Trowbridge referenced as a moat around the outside. What that means is we've got a finite resource with which we can support people, and we know that that finite resource has been stretched probably for the last 15 years, impacted further by the pandemic. We continue to see an impact of hospital surge on discharge, more people remaining in hospital for longer periods of time where their care and support needs can't be met as they're discharged. We work with our colleagues at the Acute Trust, our colleagues in the Community Trust, and as you heard, with our partners in the independent sector to manage those surges as best we can. We'll continue to do that.
Thank you very much. And just one further question before we move on to the next item on the agenda, page 88. It's the strategic risk number 14, failure of the adult social care electronic records management, including client personal data, care assessment and information. Current score is on the matrix is high. What is it that we're doing as a council to make sure that we can bring that down? Thank you.
The system itself is one that was perhaps never as fit for purpose as it was hoped. As a council, we were encouraged to chip in with our NHS colleagues and develop a one shared care record. The system was an NHS system, not a social care system. We've invested a lot of time and effort to make it work for us. However, at the same time, the NHS have disinvested in that service. So it's ended up being something that's perhaps not as fit for purpose as we need it to be, and needs replacing. In terms of the high risk, all of our eggs are in that basket. All of our social care records are held within that system. So a failure of that system would have a significant impact for us as a local authority in terms of managing that service. We have a particularly gifted internal ICT team who are working very closely with us to migrate all of that data from the NHS Trust servers onto our own to ensure that we've got a greater level of control as we manage the exit from this system to whatever our new system is following a procurement exercise.
Thank you, Laura. Is there anyone from the committee got any questions at all? Anyone from the members? Any members online? No, and outside? No, brilliant, thank you. So I propose that the operational and financial and performance of the Adult Social Care and Housing Needs Director and the Public Health Director be noted. Do I have a seconder? Thank you. And to vote. Thank you very much. Thank you. Next item on the agenda, 7D, a learning disability strategy. I will pass that you over to Laura, I believe. Thank you.
Thank you. Again, I'll work on the assumption that the report's been circulated and everyone has had the opportunity to review it. For me, a learning disability strategy for the Isle of Wight is an incredibly important strategy. Its purpose is to ensure that the folk who live in our community with a learning disability are fully supported by the services that we offer. As a local authority, since the mid-2000s, we've had a learning disability strategy in place, and this report comes before you after an extensive engagement exercise with people with a learning disability and the people who care for them in our communities to refresh that strategy. It's proposed that we update the strategy by implementing a new one from 2026 to 2031, and I'm happy to take any questions.
Any questions from the committee?
Not a question, just I'm really pleased to see that that is there and it's really useful. And I haven't read every single page of it yet, but I am looking forward to going through it. But it's really good that we've come that far with it. So thank you.
Thank you, Councillor Critchin. Any non-members? Or Councillor Lee, carry on, please.
Again, I just wanted to compliment it because I think what's important is the voice of the person, and this has included their voice. We do have a large community on the island, and it's very important that they're often people who don't have a voice, who don't have a point. So I think particularly making sure that they do have a voice is extremely important. So I welcome that in the strategy.
Thank you, Councillor Lee. So I propose that the refreshed Isle of Wight Learning Disability Strategy 2026 to 2031 be adopted, that the Director of Adult Social Care and Housing be delegated to make the final editorial or presentational changes to the refreshed Learning Disability Strategy. Any such change will not alter the meaning of the strategy. Can I get a second? Thank you, Councillor Critchin. To a vote then, with a hand, should raise a hands. Thank you very much. So we have next on the agenda is 7E, the Housing Allocation Policy Review and Proposed Changes. I will hand over. Thank you.
I apologise if it feels a bit like the Laura Roadshow at this point in time, but there's a number of really key decisions that waited for this committee meeting to take place so that we could start to progress them. And the housing allocations policy is one of those key decisions. It's a legal framework through which all of our social housing properties across the island must be let, and it's a requirement of Part 6 of the Housing Act. It's incredibly important that that housing allocation policy is updated because things change, and it's important that that's reflected. It was last reviewed in 2022, and there have been substantial changes to housing legislation in that intervening period. Consequently, what we've got doesn't sufficiently meet the needs of us as a local authority to discharge our duties, and it's on that basis that the allocation policy has been reviewed. I'm seeking your agreement today that the proposed changes in the policy are approved, and there are a few key areas I just want to draw to your attention in relation to that. They are set out in the recommendation to the report, and as corporate parents, I think it's important to emphasise that we've perhaps placed a greater emphasis on those care experienced young people and people leaving care who are aged under 25 as part of the new allocations policy. The allocations policy works on a criteria of banding, and the banding is explained in detail in the policy for you. I don't propose to go there. But what we're seeking is for band 2 to be allocated to care leavers under 25 who are assessed as being able to move into independent accommodation. This is an enhanced banding of where they found themselves before. The question I've had with my team and the discussion we've had is why not band 1? If we as corporate parents accept this is one of our key priorities, why are we not straight away accepting care leavers at band 1? And the answer to that is relatively straightforward. Band 1 is about a person's special personal circumstances. So by allocating band 2, it wouldn't prohibit a care leaver from accessing band 1 if their personal circumstances were evidenced insufficient to increase their banding. What it does is place them slightly higher up the list as the starting point. I think in terms of equity, and from the equality impact assessment that's also been produced, you'll see that what that does is stop us as a local authority disadvantaging any other cohorts of people within our community, while still continuing to prioritise an individual's personal circumstances and needs. It's the strength-based approach we spoke about earlier. It's person-centred, and what it does is make sure that as a local authority we discharge our duties in a fair and equitable way. I'm happy to answer any questions that you have in relation to the recommendation or the report.
To the committee. Councillor Blake, thank you.
Thank you, Chair. I just wanted to pick up on that point that Laura's just made. As a member of the what's formerly known as the Corporate Parenting Board, as the Parenting in Partnership Board, it's very key for us all to remember that we are corporate parents, and that where in in most scenarios, parents are looking to help their children onto the housing ladder. This is how we can help our corporate children have a bit of a boost onto the housing ladder. And I think this is a very much a needed step, and that Band 2 is the perfect place for that, given that the scenarios that ought to be allocated in Band 1. This needs a bit of a reality check to this, given the fact that we do have a deficit in the amount of social housing required on the island, that this in some cases may not lead to a quicker placement. That will obviously be reliant on a suitable allocation coming up to them. So for instance, a 1 bed for an individual rather than a 4-bed house coming up. But hopefully it gives a bit more of a boost where we can to our care experienced individuals that we look after. Thank you.
Thank you, Councillor Blake. Councillor Welling. Thank you. Thank you, Chair. Very quickly, just to follow on from your point, bearing in mind the housing stock situation is critical. What happens if somebody under the age of 25 then comes 25 and 1 day and still hasn't managed to get a house or a flat or whatever it may be?
Councillor Welling, that's a very good question, and it's not one that I know the answer to. I'm joined online by my colleagues Dawn Lang and Emma Carina, both of whom are exceptional and take all the credit for this policy. I wonder if we could invite Dawn to perhaps answer your question.
Dawn, thank you.
Hi, thanks for that question. And I think it is, as Laura said, an extremely good question. Again, I might have to refer it to Emma, but I think the view would be that if they were no longer a care leaver, they would revert to the appropriate band for their housing needs. And that would require effectively a reassessment of those needs. I think it's a really good question. I think one of the things that the report said is that we're now going into a consultation phase for this policy. It's not actually approved this evening, it's approved for consultation. So I think what Emma and I can do is have a look at that and see how we might make sure that is adequately covered in the final policy, if everybody's happy with that.
Thank you. Is there anything else that you need to add to that? Or David, you've got a supplementary? Thank you.
No, that's fine.
Have you got a supplementary, you say? Thank you, Councillor. Councillor.
I'll go on to proposing this because the recommendations are very sensible, and I particularly want to highlight the one to allow the exemption of those fleeing domestic abuse and who have related arrears. That's a reality often, and to actually then be excluded getting that is actually pushing that person back into the abusive relationship. So I'm very glad, but I'm also glad that a number of other areas like members of the armed forces, veterans, etc., also of that. So it tidies up some loopholes which often residents have fallen through. So I welcome it, and I'm happy to propose the recommendation and all the points within it.
Nice. Oh, sorry, Councillor Blake.
I'll make a slight alteration, probably relating back to the previous agenda item. Can we have a number communicated to us of how many people have been received an allocation based off the back of this policy, just so we can see some real world effects of how this policy is actually helping people, just as like whether that's an amount per year or something. Also, we can't give any information that would lead to identifying individuals, but it'd be nice, for want of a better word, for us as councillors to see an effect of our decision making.
If I may, Chair, once the policy is finalised, it will come back for your formal approval, and at that point in time, what we can do is provide you with some key performance indicators to provide the committee with assurance in terms of impact, if that's something that the committee would like to see moving forward. We report to you on the basis of what the previous committee said they wanted to see. If there are other KPIs that as a committee you wish for us to bring forward in relation to adult social care, in relation to public health, and I'm sure that public health and housing, we'd be only too delighted to work with you as a committee to ensure you're getting the information you need.
Thank you very much. And just to add onto the proposal of that the formal consultation be undertaken on the draft housing allocations policy and a further report setting out the final process policy be presented to the committee at a later date as an addition to that. Do we get a proposal in a second? Oh, sorry.
Laura, it said in the recommendations that care leavers do not have to meet the local connection. And so is that an Isle of Wight care leaver? How would they not meet? Is this all care leavers from the mainland? What does that mean? So I'm standing really daft here. To exempt care leavers under 25 from needing to meet the local connection in order to qualify. Are they Isle of Wight care leavers? What care leavers are we referring to?
My understanding is they would be Isle of Wight care leavers, but they may be accommodated off island at the point they become a care leaver. So they'd be returning to their home on the island. Really happy, Dawn and Emma, if you want to chip in at this point in time.
Yeah, I'm just wondering why they wouldn't have that local connection. But, you know, there may be other reasons that I'm not aware of. So thank you.
Hello, I'm happy to come in on this one, if that's okay. This is Emma.
Yes, please do.
Thank you. This is part of national legislation around care leavers, which recognises that they may well be looked after out of the county in which they were born. So this allows care leavers that have not to require a local connection to the Isle of Wight or actually anywhere in the country to approach for housing.
I think that explains it. It's just, I mean, as an anomaly, you're not, it might be that nationally you would go to a different county. Perhaps, you know, it's very unlikely you're going to come back here if you didn't have a connection, but it's not impossible. So
yeah, that's true. It's unusual, but we want to make sure we've got the facility for it.
Thank you.
Any more questions from committee members? No. Any from non-members or members? Non-members. Now can we put this to a proposal, please?
Into the wording that that you added. So basically the report, and just add the wording that a formal consultation be undertaken on the draft housing allocation policy and a further report setting out the final proposed policy to be presented to the committee at a later date. Okay.
I've got a second on that. As it go well then. Actually, show of hands. Thank you very much. We are nearly there. Another half an hour. I promise I'll get you home. At least it's still 30 degrees ceiling here. Okay. I was hoping it wouldn't be. So we've gone. So next item on the agenda is 7. You not hear me? Is that better? Excellent. Thank you. Sorry. It was switched on. I don't know why it wasn't working. So next item on the agenda, 7F, housing strategy and homelessness and rough sleeping strategy review process. I'll hand over to the officer. Thank you.
Me again, sorry. Again, same introduction, important strategies that we wanted to bring to you. The report sets out for you a phased approach to reviewing both of those strategies, which are key strategies that we as a local authority need to have. It proposes an approach to refreshing the strategies that we've got to reflect updated national policy, including the government's national plan to end homelessness. It's a phased approach spanning July 2026 through to May 2027. And whilst that might feel like a long time, to engage with all of the right people in the right way, it's important that we allow sufficient time for consultation with stakeholders, but with our communities to take place. The report sets out the ask, and the recommendations can be found on page 214 of your pack.
Thank you very much. Anyone got any questions in the committee? Councillor Blake, thank you.
Thank you, Chair. One thing that I've repeatedly raised is the number of rough sleepers that get reported in our KPIs and the methodology for calculating that. And I would like some kind of a change to be looked at in terms of how we calculate that to make it more reflective of reality. Given that the government suggests that there is around 250,000 rough sleepers in England and Wales, based on their calculations. However, rough sleeping charities put it more towards the 800,000 to 1 million number, which either one is correct makes a huge difference in terms of how we formulate a strategy. So essentially, are we going to have a look at, because I don't see it in the phases of this strategy development, how we calculate rough sleeping, particularly on the island, and also calculate its seasonality, because we get rough sleeping holidayers coming over in the summer months and moving away from places like London and cities like that. So yeah, let's look at some clarification on how we can look at that, please.
The way in which rough sleepers are counted is based on a national model. If we're looking to do something different locally, we need to consider what that could be and how we could allocate sufficient resource to do that. Identifying and calculating the number of rough sleepers is an eyes-on physical activity, which is why it's done on a single count basis. If we are to employ staff to specifically go out and count on a different basis, that comes with a cost that currently isn't budgeted for. I would happily take away an action to liaise with the team and identify if there is another way that we can look to provide more real-time calculation of people who are rough sleeping on the island, instead of going with the national model that we're tied to at the moment.
Thank you. Through you, Chair. Yeah, obviously part of this strategy is to how we help those individuals, as well as how we communicate that to stakeholders like the police and things like that. And when we have numbers in the official documentation that say 3 or 4 individuals, when most ward members can probably name 3 or 4 off the top of their head in their ward, then that skews how our partners are going to be looking for that. But I entirely get that there would be a cost to that. But maybe we could even take on anecdotal evidence just to put as a supplementary number in brackets, even, so say that even through ward members saying they've reported 38 on the island rather than the 4 on the official head count.
Very happy to explore alternative ways of doing that calculation. I think it will take a bigger brains than mine to work out how it can be delivered. So you'll enable me to take that away. That's certainly something we can feed back on.
Thank you. Okay, thank you.
I think from a strategy development perspective and from a needs assessment perspective, there may be something actually in terms of the strategy process that can draw on intelligence from different sources, Laura, as we do with various different joint strategic needs assessments for other topics as well. And that's maybe less about KPIs and performance reporting, but more about making sure the strategy is well designed to meet, or both strategies are well designed to meet the actual best estimates of need on the island. And I think the timeline leaves space for that work, as well as from a public health perspective, leaves space for us to make sure that we are using, as we've discussed before, all of our levers as a council to support improved health and wellbeing and reduce inequalities, knowing that housing is one of those building blocks for good health that's so important for residents in our place. So I think needs assessment and timeline for that building block of health are really positive here.
Thank you, Kate. Councillor Lee.
I just wanted to link on to this theme. I do get rough sleepers in my ward. I've got a beach and a park, which is quite attractive. And I have to compliment your team, Laura, on their excellent response rate when I do actually raise issues. The particular question comes, there is a number of rough sleepers that I've experienced who actually want to be rough sleepers and actually refuse the help that they have, which actually causes, and I do say that the rest of the council, for instance, the parks, etc., are very empathetic, right, and sensitive to to the issue. How do we, I suppose, in a sense, tolerate that? I know that there's now, isn't there a policy of not giving people tents, or I'm not sure about that, but this issue is that there are a number of organisations that do give tents. I know, for instance, Ride Aspire does in Ride. So my experience is it happens right through the winter. Some people are islanders. Quite a few people have actually decided to move here within that. How do we, I suppose, treat the issue of the choice? Because I've definitely in my ward had people who've been living a long time as rough sleepers, and are quite happy to.
I think as an instrument of the state, it's not for us to impose our will upon anyone's choice. And if a person is choosing a certain way of life, it's not for the local authority to dictate that they need to adopt a different way of life. If a person lacks capacity and needs our support in making wise decisions, then that's a very different route. On the issue of tents, as a local authority, we've never given, or certainly in my time, we haven't issued tents. I am aware that some community organisations do, where a person is homeless and they want to provide them with immediate shelter. That's not something that we have any control over. In terms of supporting people, our support is the same, regardless of whether a person is sleeping rough by choice or not. We have to apply the housing legislation, and we will always support somebody who is eligible for our support in that space. If a person isn't eligible for our statutory services, Dawn and Emma's team provide guidance, provide support, and provide signposting to help them to ensure that they can live with the independence they choose in the place that they're choosing to call home.
Thank you. Do you have a supplementary or?
No, that's it.
Okay, thank you very much. Any other questions? Everyone happy? Looks like they're ready to go home. The committee, anyone from non-members got any questions? Excellent. So the proposal is that such proposed approach and timeline to update the housing strategy be approved, that the proposed approach to the timeline to update the homelessness and rough sleeping strategy be approved, that the housing strategy, which is in place between 2022 and 2025, be formally extended to cover the period up to the end of 2027, ensuring continued compliance with statutory duties, and that the homelessness and rough sleeping strategy, which is in place between 2019 and 2024, be formally extended to cover the period up to the end of 2027, from ensuring continued compliance with statutory duties. Do I get a second? Councillor Llewellyn, thank you very much. Take a quick look. Thank you. Motion passed. Right. Verbal update. This is 7G, verbal update on the adult social care CQC report. Take it away, Laura. Thank you.
I think this is my last one, sorry. It's the opportunity to share with the committee what you've seen in the media, what we briefed you on prior to the report being published, and just to let you know that having had the opportunity to digest the report in full, we're well underway in terms of drafting our action plan. The action plan is based on the recommendations from the CQC and the gaps and development opportunities in our services that they highlighted. It's my intention that that will come to this committee for a formal adoption at your next meeting, and we will circulate the action plan ahead of that meeting to all committee members so that you have the opportunity to review it and ask any questions in advance, but also to help us shape that action plan. I'm conscious that you may be cited on things that we're not, and it's important that our action plan reflects not only what the CQC told us, but what you as ward members hear from the people that you represent. I am committed to being open and transparent in terms of our response to the CQC report. The CQC will come back, and it's important to me that I can demonstrate that progress is being made. So whilst the report action plan will come to you, please be assured we're not sat here doing nothing until you approve it. Some of the actions identified in the plan will have updates for you in terms of how we've progressed them and where we've got to. I'm also committed to making sure that not only do you have oversight, you can be assured that I'm being accountable for what have been flagged as being gaps in our services. And to that end, I've linked in with our internal audit team, and they will be conducting an audit of our progress against our action plan in Q4 this year. That report will also come to this committee. I'm proposing, and it will be outlined as part of the recommendation, that as at the same time you receive the quarterly, the every other meeting performance, risk and finance report, you receive an appendix to that report, which provides you with the updated version of the action plan so that you can track progress and remain cited on what we're doing in that regard. I hope that that's enough in terms of support at this stage. The report will cover off a lot more when it comes to your next meeting, but I didn't want you to think we weren't doing anything at this point in time. It's incredibly important that not only do we respond to the CQC's findings, we're seen to be responding to the CQC's findings, and we're accountable to you as councillors, but also to our community in that regard.
Thank you, Laura. Any questions from the committee at all?
Chair.
Thank you.
I mean, thank you for the briefing, because you have actually given briefing to us on the CQC report. So thank you for that. And I think because we've had that briefing, I think waiting for the action plan to make the improvements, which was said, is in August. So thank you.
Thank you, Councillor Lilly. Any more questions before we move on?
I wonder, Chair, having said I was being open and transparent, whether at this point I can add, for the purposes of the media, the briefing that councillors received was the same briefing that was shared with the staff team and with the media as part of our engagement. So it's the same briefing we've used everywhere.
Thank you for the addition, Laura. Appreciated. Just to note the update on that one, a show of hands on that one. Yeah, thank you. And the committee work plan. On to the next item on the agenda is committee work plan. Laura, would you like to make any comments on the committee work plan? Committee, have you had a chance to look through the work plan? Do we have any questions?
I'm pleased that we've got the mental health CQC report going to the next health scrutiny, but Councillor Garrett did actually raise for a future scrutiny meeting the issue of the NHS estate, right? And particularly was highlighting that some of the buildings, I think particularly some of the buildings are in a very poor state in services, and I think he wanted, so whether that could actually be added to the health scrutiny at a future health scrutiny meeting.
That's something we need to discuss in the group managers meeting, in the managers meeting for the committee at the moment, because I need a little bit more information on that before I can make.
Okay, if we can actually make sure that that's discussed in the meeting. Thank you.
Thank you. Councillor Blake.
Thank you, Chair. I mean, you'd have to be living under a rock to not understand that this committee oversees the largest budget requirement within this council, and also the one that has the biggest deficit in terms of the amount that it is allocated each year and how much it needs to spend. Obviously, we can take each upcoming decision parochially and look at how that topic area can be adjusted wherever possible to make those things. But I'm wondering if it's would be more proficient to have a single agenda item where we look at savings and efficiencies and transformation. We have got a £12 million transformation budget where what can be done to get ourselves out of the situation that our Section 151 officer, or departing Section 151 officer, labelled as out of control. So we, an agenda item on that, if that's possible, please, Chair.
Sorry, I'll just give some procedural advice on that. Obviously, under a committee system, we have got the Policy, Finance and Resources Committee, who are responsible for the overall budget. So I would suggest working in harmony with that committee rather than trying to bleed across into those responsibilities. I see we've got the chair here, and I'm sure that the chair of the PFR committee has taken that on board, and I'm sure that we can work in harmony on that. But I wouldn't want a committee to start committing to formal budget discussions and decisions when it sits with the Policy, Finance and Resources Committee. We just need to be a bit careful about how we manage that. But I totally appreciate what you're saying, Councillor Blake.
Thank you, Simon. Laura?
I wonder if in terms of an initial starting point, it would be useful if we arranged an engagement session with councillors from this committee and from the PFR committee, where with support from our finance colleagues, we can talk you through the budget build. I guess for adult social care is the big spender, but also for housing and for public health to support a wider understanding of those pressures and how they're reflected. And then perhaps as an output from that meeting, decide what support we can provide in terms of the report that already comes to you about finances, and whether that can be expanded to include meeting of savings targets, transformation programs and alike. Thank you.
And just to add to that as well, I think it's really important that we do discuss that in that meeting in that area, but also we have the corporate management plan coming up, and all group leaders will be coming for this, and we need ideas to put to these committees with regards to how we're going to focus on administration, as I mentioned earlier. Did you have a follow-up?
Yeah, I did. Basically an observation, Chair, from last year, but essentially this committee was left a bit impotent in the process of developing the budget, because where the budget has to be formulated in time for February, the full council in February, and of course has to go to some level of consultation before that. Essentially what happened was PFR was sat there making decisions that we weren't, being a former member of PFR, we weren't fully in the picture of what needs to be. And it seemed more proficient to me for this committee to make recommendations to go to PFR to then come back for ratification, rather than PFR going into that process totally blind and making decisions that it did not have full knowledge of, and ultimately didn't make any decisions because of that. And this committee didn't have a chance. The only committee that did was the ERT committee to input into that process ahead of that process. And I say it left this committee, in my opinion, a bit impotent in that process.
I 100% agree. It's something we discussed in the vice chairs and chairs meeting we had this afternoon, referenced that, and something we came up with. Were you on that meeting? Something that we came up with that we were going to bring together for the next leadership meeting and chairs meeting to discuss that with regards to child social care and of course with the adult social care element as well, and we can bring that together with the PFI element.
Just to thank you for that. Given that the PFR committee will start producing its plans for the budget in the next quarter, any earlier the better that we can start formulating those things, because we don't have much time in terms of committee time to do those things in a transparent process.
You and I are in total agreement. Yeah, absolutely. Thank you. Councillor Llewellyn.
Yeah, can I just come in as chair of PFR? We in the meeting you mentioned earlier, it was agreed that there would be more input into the PFR committee prior to budgets being set. As chair, I want that information so that I can the committee can make the correct decisions. So yes, we would very much welcome as much information as we can have prior to the decision-making process.
Thank you, Councillor Llewellyn. Without migrating too far off point from the committee work point plan, do we have any more questions? Anyone from members? Excellent. Let's move on. Would you like? I propose we note that plan. Excellent. Thank you very much. Well, thank you everybody for coming on this rather hot day. I don't know if that 25 is the date. No, it's definitely the date. It's still 30 degrees in here. Thank you everybody who attended. Now, thank you at the gallery for coming along. Thank you guys online, and thank you of course the staff who put all the effort into making sure that we can get all the information we require to be able to carry out these meetings. And of course, thank you committee for turning up, and young man over there, well done. That's it. Thank you very much.